registered physiotherapist. Today I'd like to talk to you about a very specific exercise that I'll use for individuals who have lots of tightness in what's referred to as their CT junction. So what the CT junction is, essentially, it's where your cervical spine, or your neck more or less, and your thoracic spine, which is sort of the mid-back region, where that meets. So it's right along this region here. Now this area here, this CT junction, it can get really tight for individuals who, for example, are sitting in front of the computer for long periods of time. You see this a lot these days with kind of the smartphones, right? So looking down for long periods of time in this sort of position. You see it in activities where somebody is leaning forward, where they're in that, again, that forward head posture, so to speak. You can sometimes see it with regards to looking down, again, for long periods of time. So the idea here is that CT junction, again, that we talked about, kind of right in this region here, it can get super tight with these prolonged either forward head postures or looking down positions. And what can also happen over time is people can develop what's referred to as a Dowers hump. And essentially what that refers to is a little bit of a bump that forms there as a result of, again, being in this sort of forward head posture, that kind of bump or that roundedness in through that CT junction. So the exercise you can do to sort of combat this, and again, with all of these exercises, you want to make sure that you first check with a physiotherapist to make sure that it's appropriate for you. But essentially what you do for this exercise is you bring your hands around sort of the neck region here, right? Elbows out in front, and then the idea is you're going to actually just repeat extensions back. So basically what it looks like is this. I'm going to just show you from the side here. So you think about kind of the nose and the elbows moving as one. So again, I'm in this position here, and I repeat extensions back. And typically what I'll suggest with this is, particularly for individuals who are having to sit for long periods of time, who are having to look down, who have this kind of forward head posture, is to sort of do this exercise just intermittently throughout the day. Again, not going into pain, and just repeating. And a lot of times too, if we're holding a lot of tension there, particularly in through kind of the upper trap area, that region again gets really tight. So when you're starting to experience some tension in through that region, again, you can go into that repeated extension position, again, not into pain at all. If you have any specific questions, concerns for me, please leave a comment below, and have a great day. Take care.